So welcome everyone, Happy New Year and welcome to our first webinar of 2021. I have the pleasure of beginning and welcoming you all to a medical education webinar entitled, Where is the Post-COVID Dawn? So before I introduce our special lecturer, Dr. Shabi Zaidi, I would like to invite Dr. Tabassum Zahra of Al Khan University to join us to moderate the session.
Assalamualaikum. Thank you everyone, and good morning, good afternoon, good evening from wherever you are joining. This session on today is very important and especially related to the scenario that we have been facing across the world. There are many questions that are being posed here, and this session is going to be conducted by Professor Dr. Chabi Zedi, who is a former professor and chair of Dow and Jinnah Postgraduate Medical College. And he has also been leading American University of Barbados and has been a WHO consultant for long. Currently, he is an ENT consultant associated with NHS UK since 2001. He has been engaged in finalizing the Encyclopedia of Islamic Medical Ethics, which is a huge thing that's going to come out. Inshallah, soon you will be having this encyclopedia, which has many authors from across the world. And many important topics that are being touched. So Dr. Zedi is leading this encyclopedia, and he has been very motivated, very enthusiastic in compiling this encyclopedia. And further to Dr. Zedi's introduction, he has been a mentor, he has been a guider, he has been a tutor, he has been a teacher to many of us. So today he's going to pose to a number of questions and try to come up to answers and solutions to like who is responsible for health and state of the society, moral, clinical, and economic trauma caused by COVID-19. What are the ethics virtues seen in health workers, and questions related to vaccine and anti-vaccines, which are across roaming and wandering across the world. So over to you, Dr. Zedi, please.
Assalamu alaikum. Thank you, Tabassum. Thank you, everybody, and welcome. Good morning to you from London. It's a beautiful morning here. It's almost sunny, but the rest of the UK is shivering at the moment. It's -10 around that time. Scotland, Yorkshire, there's been a lot of snow, but London is currently enjoying a beautiful weather. But winter is always good here, especially if it's sunny. So today's topic is relevant because throughout the year 2020, we were all suffering and we're going through a very bleak night, and hoping that with the turn of the decade or the turn of the year, we'll have a bright future, bright dawn, sunny, golden sun rays, etc., especially after the vaccines came out. But that dawn is kind of elusive. And that reminds me of a play that I saw many, many years ago, written by Samuel Beckett, where the play was called Waiting for Godot. And that's exactly what's happening right now. So we're still waiting for the dawn after the COVID era. We're still struggling. So let's start the discussion. So I'd request Shifa to kindly run my slides. I'd be grateful, Shifa, if you could move on, please. Now, everybody knows that the impact of coronavirus has been massive. It has affected everything in life. And I'll try to cover some of the aspects in public health and issues related to the common good and the characters related with health and impairment and so forth. And this is what the pundits say, that this impact of corona, the trauma that is caused globally, will take a whole generation, maybe more, to recover in terms of financial losses, health issues, and so on. It's only a tiny particle, nanoparticle, which destroyed the glory and the whatever, wisdom or whatever of the mankind in a jiffy. Next, please. And this is akin to a biblical plague, the famous one, Entine pandemic of the biblical era. Reminds us of that. And that was the plague when even the great Galen left Rome and hid into the wilderness and somewhere in Gaon or somewhere in a small village. It's happening here as well. It's almost the same picture that people are running away, like in UK, for example, or people have left their homes in the city and gone to the villages and countryside, hoping that they will escape, which is a good move in a way, but that's also debatable. It is a battle of good versus evil. And in the end, the good will definitely be victorious. Next, please. What has happened is that coronavirus has affected the common good. Now, common good is a terminology used by public health professionals. I'm not a public health person. I know there are lots of listeners on this, but I picked up this definition from various sources, particularly what we have at the moment through the net. And WHO is the main source. Common good is defined. Common good basically means that good which is for general public interest, like parks and roads and sanitation and roadside lights, electricity, education, health, etc., etc. But I'm just talking about the goodness or common good related to health, which relates to the functions which are responsible for common activities which are usually shared through or developed through combined financing for public treasury, which is the general story, but also generosity of citizens for the purpose of progressive health and economic welfare. And we see a lot of this in a lot of developing countries. Generosity is supreme over there, of course, also in the developed nations. It's a combination of these two elements, the public treasury, which is, of course, supplemented or funded by the taxes that we all pay, and also the generosity of the citizens of a given country. Next, please. Definition of health is very controversial. People have defined and discussed at length in different chapters, but I'll just take this, the important definition given by WHO. And they cover this as a well-being, the overall well-being. It's a state of complete physical and mental and social well-being, not just merely the absence of disease or infirmity. Now, each of these elements, physical, mental, and social well-being, are relevant, particularly in the effect or impact of corona, because we'll see, as I'll briefly talk you through, that it has affected not only the physical and mental, social, economical, and everything, but the whole society, the fabric of the society is fragmented. Already the fabric was falling to pieces because of several reasons, like wars and famines and what have you. And when this tapestry becomes so almost like overuse or abuse, then it becomes fragile and vulnerable. That is what has happened because of the COVID and the coronavirus. Next, please. Disability has three dimensions, and each definition has a special dimension, but I'll just cover the basic things which relate to coronavirus and particularly with my talk. Impairment is a person's disability in terms of physical structure, like the physical deformity or destruction or etc., in terms of physical loss. Next, please. Or loss of a limb, or loss of vision or memory. And all these things have happened because of corona. We've seen this. I mean, those who are in active practice, they've seen it more than I have. But a lot of people keep talking about these things that are happening constantly. It also leads to activity limitations such as difficulty like loss of vision or hearing or walking or cognitive domains or problem-solving abilities, even leading to loss of memory. And all these factors are the important components of disabilities and impairments. Next, please. What is a society? There has been a lot of debate in the social circles, particularly in the times of Margaret Thatcher. There was a lot of discussion here that what is a community? Because one of these politicians I don't want to name denied that there is a thing like society or community, which is wrong. Because society and community exist, and they exist from the day the caveman came out and saw that he needed protection, he needed solidarity, association, companionship. You see, there are 5 basic instinctive characters of the entire animal kingdom. The first and foremost is security. The first is hunger, then there is security, then there is curiosity, then there is companionship, or you can change the order. So when you come to the question of companionship, you need your companions, your friends, for various reasons. In olden days, people used to go for hunting together. So that constituted a commune, that developed a society. In modern days, even though what we see these days is not really an ideal situation, but communities and societies are important for maintenance and dignity of the people who are weak and vulnerable and people who need protection. They all go out together for earning their living, taking care of their families, education, health, etc. All these factors are deeply affected by Corona, as we've seen in recent times. Next, please. The word community actually originates from the word commune, which means collection of people. Now, who's the response? This is a very important debate that's going on in a lot of magazines, and if you read the literature these days, who is responsible for healthcare? And people are trying to shrug their responsibility, pass it on to somebody else. Is it the state that is responsible, or the society, an individual, or in certain countries, the third parties like insurance companies and things? This is a very important topic, which I'll try to dilate in a moment. Next, please. In the UK, we are blessed to have the NHS. It came into formation in 1948 because of the needs of the communities and the societies after they'd seen the miserable effect of disease like TB and cholera and typhoid and measles and mumps and what have you, particularly in the coal miners of Wales. In 1948, NHS came into existence, and that was defined and developed basically to serve the mankind and serve at the first point of contact. It was not based upon the needs. It was based upon needs rather than the affordability. And that's a contrast. In many countries, the health service is provided if you can afford it. But the NHS, the fundamental principle was that at the first point of contact, depending on the need rather than affordability. It suits an egalitarian society like the British, and I think ought to be implemented and replicated in other countries as well. It's a wonderful system. You pay taxes, you get the reward in return. And this is a perfect example of John Rawls' theory of level playing fields. That means the able-bodied with the able-bodied and disabled with the disabled and so forth. So it continues to progress, and we are very proud as British citizens to be part of the NHS. I mean, I have been involved with the NHS when it was only 20 years old. So it's a long, long story, and we are proud of it. But we're seeing that the problems are developing, and I'll talk to you in a moment. Next, please. What is happening is that NHS is now under pressure. Why? Because basically it was designed to serve the sick. But over time, it has expanded due to various reasons, political, social, economical needs, demands, aging population, and what have you. It has now included a plethora of other services, such as social services, the psychological services, the mental health issues, and so forth. So within a pot of X amount of money, you have to divide the resources to different services. So NHS per se is under a lot of pressure. It is struggling to cope with the demand, causing stressful existence of its workers. Always underfunded because of political reasons. And we in the NHS have been blaming this, that, and the other. But the problem is that somehow NHS has suffered, and there has been an attempt to privatize it. But fortunately, what COVID showed is that solidarity prevails, and people are coming back to the fundamental principles of serving mankind through charity, community spirit, and dedication. Next, please. NHS has produced national heroes over time, not just this time, but this particular pandemic has brought in the best of the heroes, best heroes of NHS. And we saw the story of this elderly gentleman, 94-year-old, who walked 100 days to make millions of money. There have been volunteers coming forward, helping out in whatever form, trying to fund it, provide the resources, etc. Nation is proud of its achievement. Next, please. What happened last year around month of March? There was an acute crisis. People realized that this pandemic is going to be miserable and create a lot of havoc. The hospitals will be overflooded. So they came up with the concept of Nightingale Hospitals. They converted very important large centers, massive centers like the Excel Center in London and one in Manchester and so forth, converted these huge areas into emergency hospitals. And they were named after a Nightingale, the famous nurse during the First World War. Now, what happened was that they were not used to the same cures, fortunately, because of aggressive attitude of the NHS staff, overcoming disasters from getting it out of control. So Nightingale hospitals remain unused. Now, the second wave has been even more contagious and infectious and threatening. So they've opened the Nightingale hospitals once again. I'm not entirely sure if they are being used, but they are available if necessary. In the first week of January, that's only last week, many major hospitals in south of London, for example, St. George's and St. Heliers and Epsom and many other hospitals were totally blocked. They were overflooded. They were not taking any more patients. There were queues and queues of patients outside. They could not accept any more patients. That was the situation last week. And only yesterday, I'll talk about that and I'm going to give you the latest figures. Things are very bad here. And same things that are here in America and also in Iraq and Pakistan, Iran, and all over the world. Next, please. This is an important factor that worries me sometimes. Managed healthcare is very popular in certain countries. Without naming the countries, people are fully aware. What happens there that instead of the state or the individual or the people combined together, third party gets involved, like the insurance companies. So when they take over the charge, things become more complex. And that is what's happening in America and also the countries where they have insurance companies. Their interests are totally motivated by financial gains. So what happens is the conflict of interest develops between the health services and the physicians and the insurance companies because they want to make more money. And this is a wonderful thing that I picked up some time ago. It's called sick tax. What they do is, and I'm not blaming any person, I'm just saying a general statement that physicians are then available for sale. These huge companies, they come forward with lucrative offers to physicians, excuse me, to travel abroad or do some research. But that is not research. That's not travel for medical reason. That's recreation. That was more like bribing. So these physicians, I'm sorry to say, some of us have done that. And my colleagues, I know some who did that. They do this job basically to promote a certain product or drug promoted by a company. And that leads to increasing the cost of medicines. And that has been called the sick tax. It has to be condemned. Next, please. Now, in many countries, like in Pakistan, I've seen Iraq, and I'm sure it's in Iran and Malaysia and various other countries, there's a combination of both. You have public and private sector. They come forward as a common good to serve their own people, and they provide the best possible care. However, many ethical questions crop up because there is a question of affordability, the quality of care, abuse of authority, abuse of power. Sometimes the services are available. And I heard this story only last week from a friend in Pakistan that a certain hospital, without naming one, they were charging 10 to 15 lakhs rupees only at the time of admission before they will accept the patient for COVID care. And many of the private hospitals have stopped admitting COVID patient. Now that is again a critical situation, an ethical dilemma, a moral question. It is a burden on the conscience of people that has to be carried by someone. Next, please. This is a wonderful term that came. It came up in 2009 or 10 when I was doing some work on the morality of medical sciences. And I forgot about it. It has recently come up in the literature. This word moral trauma or moral injury is indicative or is parallel. It echoes with the post-traumatic stress disorder, which we're all familiar with. And it weighs very heavily and arguably, according to some people, on the conscience of people, the authorities and common people and citizens and healthcare workers. And this I will elaborate further. Next, please. So what is moral trauma or moral injury? It is the prism through which we can appreciate the downstream impact on psychology of health worker, a teacher, a parent, a common man. And I'll try to give you a few examples. So moral trauma is not sustained only temporarily, but it is built into the system and has downstream effect, which can go on forever for a long, long time. Next, please. The psychological weight of moral trauma is the worst. Physical, you can overcome, but psychology and emotions and memory, they last forever. Moral injury is the psychological weight caused by transgression of one's own moral values, principles, beliefs, and practice. And we saw that in the case of healthcare workers in the UK and elsewhere. I'll give you a few examples. I'll give you personal examples of people that I've spoken to. They have suffered moral trauma because they could not provide the service that they wanted to. Next, please. Moral trauma can manifest in health workers in the form of guilt, shame, failure to do anything or serve the mankind, people who are dying, inability to save life, also lead to self-pity, inability to forgive himself, depression, mental health issues, even tendency to self-harm and commit suicide. This is the impact of moral trauma on health workers. Next, please. Also on parents. Parents have done whatever they can, and they are doing constantly, but they sustain this trauma because they felt they failed to provide the necessary education or care, personal care or what have you, of the young ones, mainly in the deprived societies due to lack of resources, but also everywhere. I mean, like it's a universal phenomenon. Parents feel guilty if you talk to them that are you happy with the education or with whatever is happening to your children? They say no. They have sustained moral trauma of a kind. So this is a new terminology which needs to be elaborated further, and people who are interested in moral philosophy should look it up and talk about it more. Next, please. Teachers have suffered. Face-to-face is still the best way to teach because you want to see the emotions, the expression, the companionship, the camaraderie, and so many things that happen. When you go to a school or a college or a university, you're not going just for education, you're cultivating your personality as a rounded up person. You want to learn from others, pick up like through a process of osmosis from teachers, mentors. That is not happening. So if you speak to teachers, like there was a debate on BBC Radio 4 a few days ago, exactly the same. The teachers feel that they're not satisfied. They're suffering with a moral trauma because they do not feel that they are doing the service or justifying their profession to the best of their ability. Next, please. So the question is, has e-learning helped? Well, like we all know, those who've been teachers, that face-to-face learning is still the best way. However, e-learning has filled in the vacuum, because if you had let the vacuum or the void to develop as such, everything would have collapsed. Vacuum, nature doesn't like vacuum, so everything is sucked into it. But with the digital technology and all the facilities that have come up, people have benefited tremendously. And I tell you, this is going to stay, even though the face-to-face learning will come back, but e-learning will continue to progress further. Next, please. It has challenged a lot of people. I was watching TV only this morning before this program. They were showing in certain areas in Wales and Lincolnshire and some areas where the IT service is not as effective as in major cities, people who live in farms. And same you can replicate to other countries like in Pakistan or Iran or Iraq or India and where have you, where even the power, electricity is not available, let alone IT and computers and laptops. If the service is not, these facilities are not available, then you're not able to benefit or gain the maximum advantage of e-learning, because technology, it is all technology based. So if the technology is deficient, you do not have the advantage that other people who are in a better position to do it. Now, who's responsible for it? That is the moral question. Is it the state that's responsible for providing these services, like it's happening in the UK? State is providing is basic. Is it happening in other countries? That is the question I leave to be answered by people who are listening to me. Next, please. Health professionals suffered a great deal. A friend of mine, a dental surgeon who caught COVID, right, I think April, for 14 weeks he was on a ventilator. He survived, but he's barely living. He still has problems. He went for a whole body scan a couple of weeks ago. He's got thrombi, emboli, and loss of memory, what have you. And they say that they wanted to do more, but they couldn't because of these reasons. Remember that story of the American nurse who left the profession as she could not carry on watching people die. The guilt of failure. She left that right. That was, I think, in the beginning, March or April last year. Next, please. clinical trauma, death, disability. We've seen a lot of this, and WHO has given, every day you see the figure that millions are dead, and death toll continues to rise. The other thing that's happened is that if you survive the COVID on short-term basis, the long COVID has come up, which has crippled and disabled hundreds of thousands of people. I know several, I'm sure you've lost, I hope that you haven't, but I have lost some very close friends and family members, and some are suffering because of long COVID. They cannot go back to their normal functioning, and they feel guilty. It's a particular doctor, as a GP, friend of mine, I was talking to him last week. He says, I want to go back, but I can't because I've almost lost my memory. I can't recall even the names of drugs and things like this. Next, please. And there has been a massive impact on finances and economics. I would call it a tsunami, which has destroyed the global economy, joblessness, destitution, poverty, hunger, loss of shelter. It has all exposed the vulnerability of mankind. The pride, the glory, the false glory has gone to ashes. It may take several years to return. I would say that it may take a generation to return to normal levels, because all these pundits who tell us on the television, the economy is collapsing. It's a meltdown that's gone. Governments are supporting through pumping billions and billions and billions of dollars and pounds into the economy. But I know personally that lots of people are suffering. Self-employed are suffering. They're suffering through neglect, a lack of availability of resources and so forth. Now we'll talk briefly about some of the impacts that Corona has caused. Social and psychological impact has led to isolation. All of us are suffering at the moment because of isolation. Anxiety, what's going to happen in the future. Depression has become a phenomenon of its own, in its own right. Frustration, you want to do something, but you can't. Helplessness, because it's lack of resources, worse than that, we cannot cure these people. I mean, doctors are basically trained to cure. The nurses are basically trained to cure, and help. We can't. We can't do anything. So you feel helpless. Next, please. Then there's a question of fear, loss of hope. Mental health issues are on the rise universally, but in the UK, it's a major, major issue. Suicides, in fact, people have committed suicide. Domestic abuse is on the rise. There were lots of reports, social problems, domestic problems, and this last bit, undignified deaths and burials, particularly for the Muslim burials in the early days in February, March, April last year. There was a massive problem. We did not know where to go for ghusl or kafan, how to bury them. There was no guidance. That was a massive moral trauma. There are a lot of ulama, a lot of scholars, a lot of leaders. They have to carry on their conscience. Next, please. Some of the frontline doctors, they went beyond the call of duty. The moment they saw that the crisis started, that was early February, March last year, they jumped into the burning fire. They did not have any PPE or gloves or whatever. Hundreds perished. Can it be morally justified? And whose conscience should carry the guilt, the moral guilt? Next question. Next, please. Now, these are the Western philosophies, the principles of ethical guidelines. They're based on deontology, utilitarianism, and virtue ethics. The virtue theory is the oldest. It started from the times of Plato and Aristotle and continues. Lately, it has been propagated by a brilliant scholar, educationist, a teacher, a medical doctor called Pellegrino and William McIntyre. And that's my favorite, virtue ethics. But I'll talk briefly about other two. Next, please. Deontology means that you do a certain things with the intentions of performing a certain duty. So my question is that all these health workers who jumped into the burning fire, did they do that because they were duty conscious? No, I don't think so. I think it was more than that. Duty consciousness is built-in system in a doctor, but it was more than that. It was not deontology, which is seen in the case of health workers. Next, please. Was it consequentialism or utilitarianism? That means to maximize the benefit to the largest number of population. Yes, that can be applied. In Italy, particularly in the month of March or April, it happened. They said, look, we'll maximize the benefits. We have limited resources, limited number of beds, ventilation. So we'll prioritize this. We'll try to expand the benefit to largest number of populations. So consequentialism was used. It basically means that you justify your act based upon the outcome that comes. That is what is consequentialism. Next, please. Virtue ethics is the oldest, like I said. Yes, these people, the health workers, the teachers, the parents, whoever came forward, they jumped into the burning fire because they are virtuous people. Health workers must be a virtuous human being. This is a mandate. And I feel that we should all agree to it. I mean, I feel, at least I strongly feel, before you become a good doctor, a competent physician or surgeon or a nurse or health worker or dental worker, you have to be a virtuous human being first. Next, please. Next. What does it mean? It means to serve the sick or help those in need repetitively, instinctively, and as a second habit. So if you feed a hungry cat once, that is not virtue. Virtue is that you see a cat which is hungry or somebody who needs help, you jump into it. You don't think, just go forward and do it. That is called instinctive desire to assist and help mankind. That is a virtue. And that attribute, in my view, should be embedded into the DNA of every health worker. Next, please. It is much more than being good Samaritan. It is a virtue, it's a built-in attribute. So virtuous health workers, neither as a duty nor a responsibility or sense of commitment, these heroes in healthcare, they jumped into the burning fires without any equipment, without any facilities, because they're virtuous human beings. And we salute them. I mean, NHS was saluted for almost a year last year. Every Thursday we would go out and raise, a clap or whatever. So I think that is a universal thing. From African Saharas to the freezing temperatures in North Canada, everywhere, the health workers, the social workers, the essential service people, the ambulance people, the cleaners, they all are heroes. Thank you. Next, please. Moral philosophy is a fundamental thing. And I strongly believe, and I've done so since 1985, when I was first invited to give a talk on ethics, long time ago. I strongly believe that social sciences, philosophy, logic, metaphysics, and medical ethics should form an integral part of a curriculum in a medical school. It should be universally acknowledged. It is good to know about zoology and botany, but I've maintained for a long time it is more important to know how to treat a human being compassionately through using logic and metaphysics and understanding medical ethics. These are fundamental things. Next, please. So when the GMC saw that people are jumping into the fire, they came to rescue and they said, the advice is that your priority, your personal safety is equally, in fact, more important. So first you save yourself before you jump into the fire to help the others. That is also the message we learn in ALS courses, ATLS courses, and CPR. The first and foremost thing is safety. You save yourself first before. Look for your safety before. This was the GMC's mandate that came out last year. Next, please. Platonic cardinal virtues are courage, compassion, practical wisdom, which is called phronesis, and justice. We saw all these characters in the health and social workers and all those people, teachers and everybody during the pandemic, and we must applaud it. We saw courage at maximum in all the difficult situations. Compassion, we saw people, giving their facility. I mean, food banks, for example. You don't hear of these things in UK, but they really were everywhere. I'm sure the same thing is happening. Practical wisdom, people volunteer to come forward to help people who needed needs. Justice always is the most important thing. It's a brick, the founding brick of medical ethics. Next, please. Also, there are universal virtues beyond the Platonic virtues: honesty, truth, loyalty, equity, fair play, and again, justice. These are international things. Universal virtues cannot be defied. Everybody accepts them. Next, please. Truth is a virtue which is universal in nature. It is one of the fundamental pillars. And this is where I feel hurt. Did the authorities tell the truth and nothing but the truth and all but truth during the pandemic? No, I dare say not. Next, please. Government, states, leaders, they disappointed their subjects. Loss of hope, faith, and loyalty was a major cause of unrest amongst them, and it continues and will continue for a long time. People will not forget. Like I said, it's a moral trauma on their conscience. Next, please. Fake data, and we're living in a fake world. You heard about the story of what happened, the American Senate did for yesterday. Fake news every day, fake presentation of death and figures and morbidity, fake information about resources. That is what led to loss of trust. People lost hope, and if you lose hope in the authority, it creates panic. Next, please. In the important factors that we have to remember in the ethics of care, the aging population must play an important role. Throughout the world is graying and aging. A lot of people in the old people's home in the UK and USA and Western countries died because there were no PPE for the health workers. Nursing homes, care homes, hospitals, they all suffered because of shortage of equipment. Same applies to other countries as well. Mental health issues, people try to get out of their small little cubby holes to get out into the open air, and they had lost their ways many times. All these factors. Next, please. I rushed through them, a few more to go. Then there was rationing. Rationing, we've heard in the developing countries, a common thing. But to hear of rationing in the developed countries is unheard of since the Second World War. But it was seen very actively, very effectively in the case of ventilators, for example, or oxygen supply, or the ambulance, or beds, or equipment, or PP. Rationing was implemented. It was enforced and still going on. I'll tell you in a minute. Next, please. Next, Shifa. Yesterday, there was rationing of oxygen in many parts of London. So somebody called me from the community to help him with oxygen because he's been discharged from the hospital. So I called Surgeon Ehsan Zaidi, who's here, and he helped me out. And somebody else said, look, try Fahim Nanjani, etc. That the possibility is there that it's not available because there is rationing. So you should ring up a certain number and get a prescription for a GP to get a canister of oxygen. Never heard of these things before, but this is what's happening here. So look at the conditions that are happening in India, for example, in Pakistan, Iraq, elsewhere. Next, please. Priority setting is an important thing. This is one of the components of healthcare, particularly when you have scarce resources. Equality and utility. Equality should be based on the service should be provided on the basis of first come, first serve, or high-risk patients. Or utility lies those who are expected to derive maximum benefit from the service. And that is where the question, the dilemma came. So if you have two patients and one ventilator, who should be given the ventilator? It's a major quality adjusted life years, disability life adjusted. All these components came up suddenly from the books where bookworms were eating them. It suddenly came up into the front. This is the concept of prioritization. The worst of, the greatest medical need, those tasked with helping others should receive. And this is the fundamental thing that WHO has promoted, that you can prioritize services like this. Methods of allocation of resources should be fair. They should be transparent. That's again questionable in many countries. Inclusive. You should not reserve it only to your community or your own people or your faith or otherwise. It should be inclusive from humanity. Consistent. Accountability. These are the factors which lead to fair distribution of resources, particularly during the pandemics. Next, please. Triage was used very regularly. Triage is a controversial subject used in the NHS on a regular basis, but it was also used during the pandemic because you wanted to extend the benefits to the largest number of people. So you had to do a triage to give priority to certain people on the others. Next, please. These are normative bases of triage. You maximize the benefits, just like utilitarianism or consequentialism, but you must also observe justice. Next, please. Now, this is a wonderful paper that came with the GMC published these figures. Workforce in the NHS in, I think it was August, September of 20. 54% were Black and minorities. They succumbed the most in the early days of the first wave. They're called BME. They were less likely to have positive change than the white, and so forth. This is a study that shows that this community is a mixture of all kinds, all colors, all races, and they all came forward to help mankind, irrespective of faith, color, race, or whatever. And that's a wonderful lesson to learn. Next, please. Learning from personal experiences, 32% of doctors said that the pandemic had adverse effects on their physical and mental well-being. 43% felt that safety was compromised, which is a fact. 26% felt that patient safety was compromised because of lack of PPE and the equipment that's necessary. Next, please. Medical education suffered intensely. 74% of the trainees felt that training was adversely affected. 78% of trainers felt their role as a trainer was affected. This is what is the 78% will take moral trauma on their conscience. They tried to do, but they couldn't. Next, please. This is a figure only of yesterday. More than 1,000 deaths, 1,325 yesterday in England, and 79,000 in the UK. A major incident was declared in London by the mayor. 1 in 20 are affected. Massive, very bad situation at the moment. We're just hiding, hibernating. The moment you go out, you're vulnerable. Ambulances were short. Many people, ambulance drivers were called in to serve as assistants, and doctors, senior doctors were called in to serve as the nurses. This is the news that came up yesterday. Next, please. ECMO, which is rarely ever used, and I know only a few centers in the UK, extracorporeal whatever oxygenation used by some people, but that was used yesterday. 3,000 requests were, there were only 100 ECMO facilities available in the UK. And this is a major issue. I don't know about other countries, but I've not heard of it before. Occasionally you see in cases the ECMO is used. Dr. Yadullah, one of our colleagues, he used to be an expert, he's currently away. Somewhere else. Next, please. 50% of staff are either self-isolating or sick with COVID. So there's acute shortage of staff, and therefore it leaves the elderly to be more vulnerable than before. Next, please. Right, last year, after a bleak and miserable night, we thought that there's light at the end of the tunnel. We thought the vaccines are coming out, safety, reliability, efficacy, and availability were the major issues that were discussed by the pundits. Next, please. The challenges were cost, logistic challenges, prioritization, who should get first. And the first thing that was happening was anti-vaccine propaganda. It is called infodemic by some people. I was amazed to read these stories about famous sports people coming forward, and they're saying that, look, this is not desirable. You don't need a vaccine. Amazing things. Next, please. There's more to come. Now, these anti-vaccine people, we've seen the stories in Pakistan where people against polio have destroyed a lot of it. Polio is affecting only 2 or 3 countries. So this campaign is still going on. Only yesterday, somebody was telling me in the UK, there's a massive campaign going on against vaccines. And that is a sad story. They say there's a chip in it and a microchip, a DNA will be altered and what have you. Logistic challenges are the other things. The Pfizer BioNTech vaccine has to be stored at 70 degrees minus, which is very challenging because you need special refrigerators. And in the UK, they developed special sites for it. But in a country where even the basic power is not available, this becomes a major challenge. Next, please. Oxford AstraZeneca vaccine came up. This is a ray of hope, a golden sunshine, because cost effective. It's only £3 here. And it's durable, stable at 4 degrees centigrade, so reliable, and they say it's 95% success rate. And now they're also saying that even one jab is good enough to give you a reasonable immunity. You can wait for the second jab, because let everybody get the first jab first, then go for the second dose afterwards. Next, please. And this is what came up only yesterday. Moderna vaccine has now been given the clearance by the NHS, and it will be used. And like I was saying earlier on, Army has been called in to help the vaccination of general public. I understand, and I've heard in the news and through my friends, that there are many other vaccines coming out from Russia, from China and Turkey, and the experiments. My friend Dr. Ataur Rahman was on the TV the other day in Pakistan and says that already they're working a lot of things. Dr. Bukhari is also engaged in a research and a clinical trial. So hopefully things will get better and better in due course of time. Next, please. Early results are very encouraging. Nearly 1.5 million have been vaccinated in the UK. 15 million will be vaccinated in the next 2 months. A lot of people, it's a lot of data that's available. Every day it's changing. I don't know whether you can trust them, but I would like to believe that's right. Next, please. This is what I was saying, anti-vaccine campaign. A lot of population has been negatively fed with information that may change your DNA because in mRNA vaccine, it contains a microchip, it's active, it may kill you and so forth. That's all rubbish. It is mandatory upon health professionals to come forward and demolish this negative propaganda and tell people that prevention, next please, I think that's what I've written somewhere, go on. That's towards the end. Disseminate the message, prevention, 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 as there's no cure. People have tried various things, including the Dettol by a certain man, many last year, etc. And so many things. Nothing, not even cortisone, nothing. You have to prevent, and vaccination is the answer. Next, please. So the take-home message is equitable distribution of financial resources. What has happened is the world was flooded with money. Lots of spare money was available. But what was happening? Because the money was being used for distant wars in distant land, buying planes and bombs and killing people, not for developing these prophylactic measures, not for training and educating masses to come forward, help themselves, improve the quality of life, improve the healthcare and so forth. So that is a sad part. Financial support should be given to the less fortunate population, increase their health standards, raise their living standards, and all these factors, which the global health authorities, the pundits, the rich and the famous, all these people that you hear about every day, that this man becomes the richest man in the world, is going to the Mars and so forth. What good is it if you can't serve the mankind? You have to serve the mankind first. And the important thing is avoid, and this is a message to the Western powers, avoid global and regional conflicts which drain the resources, use them for better purpose, to improve the quality of mankind across the world, especially in the developing countries. And I strongly believe that WHO must be strengthened above and beyond politics. Next, please. This was a dawn that we saw on the first day of 21. It is almost like a fiery dawn. So we're still waiting for that dawn. But what I saw this morning is interesting. Have a look at the next one. This is called the flamingo dawn. So sunshine is trying to creep in, despite the weather being wintry, there's snow and everything, trees are bare, but bright sunshine is creeping in. And soon the darkness of COVID will be over, will be free of all these dramas of pandemic and so forth, and bright sunshine will come forward and will rejoice once again. Thank you, and I'm ready to answer any questions.
Thank you so much, Professor Zedi, for shedding light on such an important topic. Despite of challenges that you have addressed and you have mentioned, I also foresee that, despite of having a vaccine being developed, and as you have mentioned that the requirements for the vaccine is going to be like, minus 70 degrees. So there's still a challenge of the supply chain. How this is going to be supplied, either it's going to be, used by only countries where it can be stored at that particular temperature. So there are challenges and there are questions still which remain unanswered. So I would like to also seek your opinion on this important question.
Like I mentioned, the first vaccine that came up was Pfizer BioNTech. That was to be stored at minus 70, and they started in the UK. But this new vaccine that's coming out, in fact, the third vaccine, Moderna vaccine and the Oxford University AstraZeneca vaccine, they can be stored in ordinary fridges, and they should be easily available. And they're much cheaper, only £3. £3 is not that much, especially in the UK, of course, the NHS provides everything. So my answer to your question is that the expensive vaccine will be difficult. And I think what I gather from other friends in different countries, they are developing their own vaccines. I mean, China has come forward, which is usually cheaper than the rest of the vaccines. So logistically, a vaccine which can be stored at 4 degrees centigrade, which is an ordinary fridge, and it's available at a small amount, which compared to, say, X amount of money by the other vaccines, I think it should be easily accessible. But the message goes out to everybody. Get vaccinated as soon as you get the chance, because that's the only answer. Thank you.
Yeah, thank you so much. I think there's a question which has already been answered by you. So there was a question whether I should take the vaccine, and you have already answered that yes, go ahead and take the vaccine. Um, so let's move on to the next question. So, how do you see the change in behavior of medical professionals after the COVID era?
Two things will happen. I think a lot of medical science will be directed towards preventive aspects. Remember, as students we knew, as teachers we learned, prevention is better than cure. But over the time, because of technology, because these third-party interests, technologies, I mean, I had a friend of mine in Birmingham who used to say that technology is chasing physicians, and where it is almost like a race between a hare and a hunter. The hunter is constantly chasing it. The hare finds a way, hides into a little bush, gets away from the hunter, comes back, the hunter is still waiting. So he goes with another technology. So all these technologies, which are welcome, no doubt about that, but we should not be driven by technology. We should not be dictated by technology. Our moral conscience determine what is the best answer. So prevention, I think, should be more important. And that should be taught in all medical curricula. The second thing, I strongly believe that you do what you feel like, but moral philosophy and medical ethics should be taught to people, because we saw so many things that people did because they did it because of natural reason. But if they're taught properly, what is virtue ethics? What is deontology? Then they can apply those principles in day-to-day life. Humanity is based upon the level of understanding of education. Knowledge is nobody's property. It should be propagated irrespective. That is why we are doing this. E-learning, this technology, this online courses, and all the effort that people are doing. It's because we want to disseminate knowledge. So medical education has to be more pragmatic, preventive, pragmatic, and they should incorporate modern philosophy and other things which are left out in the wilderness.
Yeah, thank you. So there are a couple of questions again related to clinical aspect of the vaccine. So are there any major adverse reactions that have been reported after the use of the vaccine?
There were two cases that were reported after the first vaccination of anaphylactic shock, not shock, anaphylactic reaction, and they were hospitalized and treated. Since then, I've not heard any. I'm sure that, see, any vaccine can lead to side effects. It's not unusual. I mean, I have flu vaccine every year. So on a day that I have vaccine, I usually have a little headache, a little mild fever and so forth. Nothing extraordinary. Besides, I think there's a warning that goes out, and experts can tell us more. If Gaurav Wajid is here from WHO, he might be able to tell us that the warning is given to the people who have a tendency to react to various vaccines, and if they have any underlying allergic response, like chronic asthma or skin rash or whatever, probably they should be more cautious. But you always have these facilities available. If somebody has a reaction, you have adrenaline pen, which is available to overcome, or steroid or what have you.
Yes, of course. Every vaccine has some kind of either be a minor reaction or another aspect of the reaction, but there's still reactions limited to time.
Yes.
So then,
Sir, can I ask one question?
yes, Dr. Buhari.
Sir, can I ask one question?
Yes.
What should be the priority for the vaccination?
Priority in terms of what?
Giving the vaccine.
Who should get first?
Yes, we should get first.
Well, the first, and for, like I said, prioritize the most vulnerable should get first. That means aging population, people like 80 plus, people who have underlying comorbidities like diabetes or heart condition or chemotherapy or radiation or something, people who have poor immunity, they should be prioritized. And I think I can give a very simple example. The other day I was talking to a friend who was a doctor, said, why can't you get it done yourself because you're in the NHS? I said, look, I'll wait for my turn. I'm not invited. My GP will call me when the time comes. to go and bypass because I have contacts, that is unfair. That is immoral. My conscience will not accept it. I'll wait for my turn. When it comes, I'll go for it. So priority should be those who are vulnerable, those who are more susceptible, they should get first. Then in the order of age and vulnerability, and of course, health workers, those who are in the frontline health worker who are exposed, they should get priority. Yes.
So again, there's a question related to ethics in clinical practice. So what is the myth of COVID in China?
What is what? Say it again.
The myth of COVID, the disease. Yeah.
I can't tell you that. I think that's a question that is open to public. They can answer. What is the myth? I mean, it all started from Wuhan, as we know. I mean, we read in the literature and magazines and what have you. It started from a bird or an animal or something, and it just jumped from. And it can happen again. I mean, it's not. And it's happened before. It can happen again. So it started from Wuhan. All these stories that got it was released by some scientists sitting in a lab, and the virus was being built. It reminds me of the story that we had once upon about 10, 15 years ago about anthrax, about various things that came out in the public. Suddenly, scientists, a mad scientist sitting somewhere in a lonely corner, depression, etc. I said, look, let me teach them a lesson. No, this is a true disease. This is what's happening. I was listening to LBC this morning and saying, somebody said, look, it's all story. No, it's not a story. People are dying. It's a fact. It's a fact of life. Some of my friends have died. Some colleagues, I mean, everybody has somebody who's been affected. So there is no myth. It is a fact. It started from Wuhan. Probably there was some delay in reporting it. But one of the questions that is often raised is that how come that they built vaccines so quickly? Normally it takes years for experimentation and so forth. I had no answer to it. Then I saw a documentary by Panorama on the vaccine, this Pfizer, BioNTech, and an Oxford vaccine. And they said the answer was very simple. Once the genome was given to them by Chinese, right at the beginning, soon after, then they had the basic mechanics. Then all that they needed was to fill in the gaps and then come up with these various combinations. They showed a beautiful program, how the labs were working constantly interacting with it, sharing the information, etc. So it was a massive effort. That is why the vaccine, because people are dying. I mean, everywhere. You've never seen such death and atrocities every day in life. I'm told, by even Dr. Bukhari told me that people are dying in Lahore, outside on the cots because there were no beds. And I'm told by same stories from India, same stories that came from Iraq, everywhere. So I think it's a global phenomenon. So mankind got together, scientists got together, they came up with a vaccine. And that Panorama program on vaccines is worth watching.
Yeah. So there are a couple of questions which are related to education. There was one question which said that how do you see medical students being affected, because of this COVID, and what do you see themselves as the future practitioner?
Well, again, like I mentioned in my presentation, that the data that the GMC published in paper, GMC is the General Medical Council that guides us in those who practice in the UK. It's like every country has its own licensing body. They realized that medical education was affected in X number of minutes. I gave you a figure earlier on. And I think it's global. People have suffered, not just medical education, even at the undergraduate level, at high school level, primary and secondary and everything. Look what happened last year. The teachers, the exam, the debacle that happened in the GSC exams last year is an example. It was handed over to a machine, algorithms. Algorithm would determine the results of the GCSE. So what happened was people did not deserve A levels or A plus, they got A plus. Those who did not, those who did, who deserved it, they got C and D and E. So they had to go back. Mankind is supreme, and mankind must be supreme only on the basis of learning the etiquette, mannerism, philosophy, understanding that mankind's first and foremost role is to serve mankind with authenticity, authority, honesty, integrity, and justice. So medical education has suffered. It will continue to suffer. Yes, E-learning has helped, no doubt about that. But face-to-face learning, surgical training, you need to see a patient, palpate the mass. How do you know that? Whether it's masses, a cyst, or a tumor, all those things. See, surgeons' index finger is the third eye. You can't do that through digital technology. I'm sorry to say that. I'm a great fan of digital technology and what have you, but medical education should go back to actually seeing the patients in due course of time. And of course, morally, all those have seen, I know several in my family, the youngsters doing medical education in Manchester, they have suffered. They feel that life is a different thing altogether, and they went to volunteer into different camps. Even my grandson, the twins, they went out to Red Cross to help people. Everybody's affected. Everybody's affected. Anybody who has conscience, anybody who has a family background, who understands the importance of serving mankind, went out of their way to help, financially, morally, physically, and in terms of medicine, whatever they could. I think it's a global phenomenon. Basically, mankind is good natured.
Yes. So related to this, there's another question which says that uh, there's been a recent suggestion that there's a need to increase the number of seats in medical schools in UK. So more so because many doctors now want to work part time. So what is your comment on this?
That is true. That's happening. That's happening. That's been constantly going on. They are increasing the number of seats all the time. And the reason is twofold. A, that a lot of population, a lot of senior practitioners, I mean, some of my friends, they took an early retirement because NHS is under a lot of pressure. A lot of information has to be gathered. I mean, like people who work, and there's lots of people on in this talk also. You have to fill in the forms and data and this. So instead of becoming a good doctor, you become a good technician or a clerk. So a lot of people could not cope with this pressure. Then there's a question of audit and all these various courses you have to conduct, at least 10 to 12 courses every year to maintain your license. So people could not take that pressure. And then there's this new thing that's come up, which is unusual in the UK, not 20 years ago. In only recent times, it has become a kind of society full of litigationists. So people look for an opportunity to find a fault, go for litigation lawyers and start suing. Now that in an egalitarian society, the UK was unusual. This actually came from across the pond, where there are special lawyers. You see them swinging on the chair on television that if you've been hurt, tell us, we'll take care of things, that kind of thing. So yes, so education, yes, seats are increased, and also because there's an acute shortage of doctors. So it's happening everywhere. I think globally, you need more doctors, more nurses, more health professionals, because the world is growing fast and a lot of them are aging. And aging population have many comorbidities, so they need more care. Thank you.
Yeah, thank you so much, Dr. Zadi. I can see a hand raised by Iman Abdullah. So I'll allow you to ask your question.
Go ahead, Iman. Can you help Iman to get this question?
Iman, can you hear?
Yes, go ahead.
Yeah, please unmute your mic. Your mic is muted.
Sir, your mic is muted.
My mic is not
No,
muted.
Iman Abdullah's mic is muted. Okay, in the meantime, Shifa can get in touch with Mr. Iman Abdullah, and then we can take his question in. So the next question, is related to there's something like um, the BBC documentary which shows how the food supplies are being given in Nigeria and different African countries. So what is your comment, and will this affect the spread of COVID-19?
Well, I think people who are doing these voluntary services, they should be applauded. There's a lot of good Samaritan approach going on across the world. It's not Nigeria, everywhere. People are going out to help people it happened in the UK, in London also. Food banks came up. Lots of people who are rough sleepers, they were given shelters and so forth. It's a good spirit. But of course, it's mandatory upon them that they should be careful when they go out to serve the other people. They should go through the COVID test, which is now available to everybody. And if one is positive, you should go into isolation for at least 10 days now. It used to be 14, now it's 10 days. And of course, not spread the virus to the other people. It'll be unfair that you provide them with food, but also give them a virus. No, that's unacceptable. But they are very cautious, they're very careful and positive.
Yes, thank you. I can see there's a question from Dr. Abu Tahin. Dr. Abu Tahin, would you like to unmute your mic so that you can raise your question, because it's not coming up in the QA box anymore. So if you would like to raise your question, you can unmute your mic. Shifa will allow you to do so.
Thank you, Dr. Tabassum. Thank you, Dr. Shabir, for the nice presentation. Thank you for allowing me this opportunity.
Welcome.
Dear Professor, my question is regarding the rumor and the misinformation that hugely disseminated during COVID-19, and unfortunately, many medical personnel, many physicians had played a negative role, an exaggerating role in non-professional attitude in dealing with the information and many false issues. What's your opinion?
Very simple.
How can we deal with this now and in the future? What's your suggestion, opinion? Thank you.
The answer is very simple. Condemn them, ridicule them, expose them. They're black sheep amongst you. They're dishonest people. They're disloyal to their profession. They're breaking the oath of profession, Hippocratic oath or whatever they've taken. One should be careful. I mean, disseminate knowledge which is positive, not negative. You try and cut down the negative knowledge. I mean, like I talked about the campaign going on against vaccines. It's ridiculous. What is the answer? Either die or have preventive measures. So I think that should be condemned. Any kind of propaganda by profession or otherwise, you should come forward and tell them they're wrong. The correct figure is this, and you can quote the figures from the data, Lancet, for example. If you look at the Johns Hopkins reports, every day they're publishing reports, how many people died globally and so forth. Give them the facts. If they're physicians, they should be confronted with the facts. Put them a draw sheet or what's called the fact sheet in front of them. The death, the morbidity, the after effects against their propaganda. So confront them, expose them.
Right. So there's one more hand raised, Dr. Ali Moazami.
Welcome, Ali.
Can you hear me?
Yes, I can.
Okay, good presentation. Thank you so much, Prof.
At your service.
So, as you know, there are so many vaccines all over the world that those are approved by official organizations. Yes. So let me to know about your idea. What is your idea? Are you optimistic in terms of efficacy of vaccination, or you're pessimistic?
Yes, the answer is very simple. Yes, because there's a lot of.
Thank you so much. Could you explain about that? Thank you.
Yes, I will explain to you. You see, when the first vaccine came out, that was the BioNTech and Pfizer vaccine. There was a lot of controversy whether it's effective, efficacious, reliability, etc., etc. But obviously, the clinical trials and experimentation and what have you done, the data was published. Then came the Oxford vaccine, Oxford AstraZeneca vaccine. And the data that's coming out shows, and I'm quoting your figures only from yesterday, 95% success rate. Now, more than 1 million people have already been vaccinated in the UK, and I'm sure other countries will have the similar figures. So if you have that much data available, it's reliable, it is safe, it is trustworthy, and it's cheap. So the important thing, like I mentioned in my presentation, that vaccine should be cheap, There should be no logistic challenges. Like the problem with the Pfizer BioNTech vaccine was it had to be stored at -70 or -80, which was difficult in countries where there's no power supply and you have to carry special carrier and so forth. But at 4 degrees centigrade in an ordinary fridge, if you can store the Moderna, I believe is the same as is the Oxford. So I'm optimistic, and that is the answer. We have to vaccinate people as fast as we can. And in fact, there was this discussion only this morning that why is it that pharmacies are not being used? I mean, normally in the UK, if you go for a flu vaccine, it's a pharmacist who does it. You don't go to a GP or anywhere. But this time, even the pharmacists, and that I think is somehow lacking. So maximum utilization of power and supply and resources and manpower to gain access or to provide access to as many people as possible, as quickly as possible is the answer.
Yeah, thank you so much, Dr. Zedi, for this elaborative response. Uh, there's a question which talks about the paradigm shift. So, can we see COVID as a trigger for the paradigm shift, like shift from reductive medicine to holistic medicine?
Oh, yes, absolutely. Absolutely. I think this discussion has been going on in the academic circle for quite some time, that medicine had become too cornered into more like digitalized in a way and more like very confined to basic things that you see. You don't even touch a patient. You see from a distance. You look at the computer. You're not talking. You're not even. I mean, in my practice, I saw that you're looking at the computer, taking the data, not even looking at the patient. This is a sad story. The whole thing is interactive. So holistic medicine is the answer. You have to take not patient as a person, just as with a physical or other disabilities or disease, but the living environment, the social factor, the economic factor, the habits, the habitat, the culture, the anthropology, everything comes into picture. And I think that should be a part of future medical education, yes.
Yes, and so related to this is that is providing vaccination to people is a moral obligation for ministries of health in every country. So, what are your thoughts on this?
Absolutely. Like in my first initial 2 or 3 slides were exactly who's responsible for the healthcare? State, the community or society, or the third parties or individuals. I think it's a combination of all. Basically, it's the state's responsibility to take care of its citizens. It's common good. That is the fundamental thing. It's been there from the times ancient, from the days when people started living like a civilized society. So it is the responsibility of the state, that means the health authorities. And then comes the authorities down the order, people, individuals, communities, volunteers, charitable organizations, and international agencies like WHO and all these agencies. I don't want to name them, but they all should come forward and help.
So, thank you so much, Dr. Zedi. This was the last question. However, there's a comment, and a very interesting comment, that only ethics can save us. This is what COVID has tried to convey to us. Um,
I couldn't agree more with that.
yeah. So we agree to this, Dr. Ali Tarek. A very nice comment. And I believe that we have also learned how to take care of ourselves, our personal health, take care of our family members, and uh, health and hygiene has been an important aspect of our lives now more than it has been in past. So this is something that we have learned from this era of COVID-19, and this is all with the questions that I have received and the questions that are being asked by the participants. So thank you so much, Dr. Zadi. Wonderful presentation and a very enlightening aspect of COVID-19 and the way forward. Over to Shifa now. Thank you so much.
Thank you, Tabassum. Shifa,
Thank you
would you
so
like
much,
to
sir.
announce the next program? We have clinical seminars coming up and interactive discussions.
Yes, for sure.
Great. First, let me thank everybody. Thank you for listening to me, my incoherent presentation of what is a fact. And I think Ali Tariq is absolutely right. Moral philosophy and ethics should be taught on a regular basis. And I think we should all learn from the experts in the field of public health. Keep your distance, be careful, wash your hands regularly, isolate if you are concerned, and be extremely careful against the spread. The latest version of this virus is very infectious, very contagious. Be careful. God save you all. Thank you so much, and over to Shifa.
Thank you so much, Dr. Shabi Zaidi, for your enlightening presentation. And this is just one in dozens of presentations that SIVU will be hosting this year. I'd just like you all to take a look at the following poster. We'll hopefully send it out in the next coming days as well, which is a upcoming presentation on updates on diagnosis and management of coronary artery disease, featuring Dr. Arshid Qayyumi and moderated by Dr. Hussein Shabi. So please, again, visit our website. We'll be releasing the schedule for the next 3 months very, very soon. And we hope to see you there.
Thank you.